Pradeep Pindiala, Professor of Anesthesiology. Wish you all a very happy and Merry Christmas to all of you. And Happy New Year in advance. Well, today I am going to talk briefly about blood transfusion and how do you manage. Very, very briefly. Basics. The first thing, what do you understand by massive blood transfusion? The first thing which would be asked about blood transfusion is what is the definition of massive blood transfusion. I'm sure you should be able to answer it. Replacement of one whole blood volume within 24 hours. What is one whole blood volume in a human being? If it is a male, it comes to around 60 ml per kg body weight. If it's a female, it's around 65 ml per rather, it's for the male it is 70 ml per kg body weight, and for females it around 60 ml per body weight, and for children it is slightly more, 70 to 75 ml per kg body weight. Ain't it? So if you want to replace the entire patient's one whole blood volume within 24 hours, it would be known as massive blood transfusion. Otherwise, it can be if you are replacing 10 units of packed red blood cells, okay, within 24 hours, 10 or more packed RBC, if you are transfusing within 24 hours, it's known as massive blood transfusion. Other definition also, like if you are replacing more than 50% of blood volume within 24 hours, or approximately 50% of blood volume if you are giving within 3 hours of trauma, then also is known as massive blood transfusion. Or if you have transfusing more than 4 units of blood within 1 hour. Or else more than 40 ml per kg body weight in 24 hours. That's all these definitions are the same, one and the same. The principles are very simple. You have to liaise with all the other departments also. It's complex and it's very challenging. Blood transfusion is not all that easy. You have to liaise with other departments also. Surgical department, pathology, blood transfusion, everything. Obstetric hemorrhage means trauma. All have to be together, like anesthetist, surgical team, radiologist, lab support and transfusion technicians, all have to collaborate, and you have to liaise and coordinate for giving blood transfusion. That's very essential. Talking about packed RBCs, I'm sure you know, is basically to improve oxygen carrying capacity. And loss of more than 30% of blood volume. You estimate around 4.5 liters or 5 liters blood volume in a person. More than 30% of the blood is lost. That means more than 1.5 liters have been lost. It's a critical level. Then you have to give RBCs, preferably packed red blood cells, PRBCs. Okay. And RBCs must be transfused if the patient is in shock or when you have already given crystalloids and there is no much response and there is ongoing bleeding more than 150 ml per minute. You have to give packed RBC. And idea is to bring the hemoglobin to more than 10 grams per deciliters. Rapid transfusion, that means 1 unit over 5 to 10 minutes you have to give. And it's very prudent to warm the blood before transfusing. Otherwise, the patient would develop hypothermia. Very important. Preferably, it should be group specific, compatible blood RBCs has to be given. If you are very damn in hurry and immediate requirement is there, then you may have to give Group O RHD negative RBC. Okay, and talking about fresh frozen plasma, and it normally replaces coagulation factors. Best form of replacing coagulation factors are fresh frozen plasma. I'm sure you know it. And when the prothrombin time is more than 1.5 times the normal value, that's the time fresh frozen plasma must be given to replace the coagulation factor. Earlier, we used to give 1 unit of fresh frozen plasma for every 4 to 5 units of RBCs administered. Now things have changed. We give 1:1. That means for every packed RBCs, we give 1 fresh frozen plasma. That is it. And talking about platelet transfusion, by the way, you have to thaw it. Fresh frozen plasma, just don't give it straight away. Thaw it, and then only transfuse. Okay, thawing is very essential before giving fresh frozen plasma. And talking about platelet transfusion, that's very important. And now the ratio is 1:1:1. That means 1 RBC, 1 fresh frozen plasma, and 1 platelet. That's the ratio we have been giving now, the latest recommendation. And that's been very beneficial effect, especially in severe trauma and post-operative hemorrhage and increased survival. That is the combination you give, platelet transfusion. Okay, and now interestingly, things are coming back to our interest in whole blood also. We started with, whole blood to component therapy, and now there is a renewed interest in fresh whole blood. Okay, group O, preferably. Talking about fibrinogen concentration. Fibrinogen concentrate also is very important, especially if the fibrinogen level are less than 1.5 gram per liter. Then fibrinogen should be replaced in the form of fresh frozen plasma, cryoprecipitate, or fibrinogen concentrate. Okay, hypofibrinogenemia is a common finding, and the fibrinogen is the first factor that falls into critical level in trauma and massive blood loss. And talking about, before that, I must stress the fact, never forget using tranexamic acid in massive blood loss, trauma patients. It's a wonderful drug. Just give it without any hesitation. The dose is 1 gram loading dose, bolus dose, followed by infusion of 1 gram over 8 hours. It will definitely be very useful in bleeding trauma patients associated with significant reduction of mortality. Please use antifibrinolytic agent, that is tranexamic acid. This has to be used to prevent fibrinolysis and to reduce surgical blood loss. Just give it. Strongly recommended, especially postpartum hemorrhage, intraoperative major blood loss. Just give antifibrinolytic agent, that is tranexamic acid. Just now I mentioned 1 gram bolus followed by 1 gram over 8 hours. Fusion of 1 gram over 8 hours. That reduces the great reduction in mortality and wonderful improvement in, especially in bleeding trauma patients. Just give it. Okay, but preferably after trauma and blood loss within 3 hours. After 3 hours of injury, if you are giving tranexamic acid, it can harm. So please be careful. Tranexamic acid is a wonder drug, but should be given within 3 hours of the trauma or injury. Okay, and many people still believe when uncontrolled bleeding is there after trauma, for hemostatic therapy, I said, activated factor 7, okay, R7A. But still, the present role of recombinant activated factor 7, R7A, is not well established. It's still unclear. So, think about it before giving activated factor 7, because the thing, it's not very clear whether it can improve the situation or to manage uncontrolled bleeding. Thanks for patiently listening. Once again, a Merry Christmas to all of you. Bye bye. Take care.